Hafaday Guam and all that are viewing here. I'm Adriana Cotero, and I am joined with the Department of Corrections Administrative Services Division Chief Major Antone Aguon. Now, Major Aguon, we're discussing some of the security measures that are in place currently right now at Department of Corrections, both facilities. This includes the Manilao and Hagatan facility. If you could just tell us what those are now that, in the wake of COVID-19, can you just kind of highlight what some of the different measures and actions that you guys have taken?
First of all, one of the things we've done is we've suspended all social visits. So all the inmate and detainee visitation has been suspended for 30 days. We've also, in regards to moving inmates around from facility to facility, we've minimized that. We've suspended religious services, so volunteers are not able to come in right now. Also, the tours and things like that we're not doing anymore. We are screening all the new confinees coming in. We do have a place in Agana for them in the event they need to be separated. If they're showing any symptoms or signs, then we follow our GMH's protocol. So we do have on-site medical staff at DOC, both at Agana and Manilao, to address any of the issues that may come up.
Now, as we know, at the prisons on island, the population density kind of creates a major risk here. So I know early on you guys put these different protocols in place. I think it was March 16th, and you said that they were suspended. Is it a 30-day suspension as far as the social visits and tours go?
Yes. As of now, the order is 30 days, and of course it will be reevaluated at a later date to determine if we need to continue it or it can be adjusted.
Now, 30 days is obviously a drastic difference from the mandatory that everyone else is serving the self-quarantine of 14 days. Can you tell us why take the extra step in having the 30 days?
Well, again, we just want to be extra cautious because the population that we have and trying to ensure that, it does not get into our population as best we can. In the event it does, that could cause us some serious problems. So we just, for now, the director decided 30 days would be the best for now. And again, if situation changes, then it could be less. It just depends on how this situation develops.
And as of right now, there aren't any inmates or detainees that have any symptoms reported.
No, as of now, there are no. Yeah, as of now, there are no inmates or detainees that have displayed any symptoms. So as far as we know now, we don't have any COVID-19 in our facility at this time.
And I recall from the recent on-site visit that I went on, along with the Federal Public Defender's Office as well as the U.S. Attorney's Office, that you guys had at just the Hagatan facility. There was 2 nurses from GMH there. How many are at the Manilao facility? And have there been more nurses added?
On the Manilao facility, we have. No, we still have the same amount of nurses. The nurses are there from 6 in the morning to about 10 o'clock at night. And so they're on each shift, there's probably about 3 to 4 nurses per shift.
About 3 to 4. And they're all they're doing.
That's not including the 2 that are on Agana.
So the 2 at Agana, those are the ones that are doing that are controlling the confinement space and they're doing the pre-screening?
Yes, because all the arrestees, all the male arrestees check in through Agana. And so the nurses, when they come in, they are processed and the medical staff does their medical assessment.
And that's at the Agana facility, correct? Can you tell us a little bit about the confinement space that you guys have created, the isolation? I think you told me that there was a block that you have set aside for isolation.
Yeah, so when they come in, yeah, so when they come in after they've been screened, there's a portion of the Agani detention facility that all the overnighters and the new arrestees are kept. Uh, they are kept there. If they are, because some of them may be getting released that day, depending on the courts. If they get magistrated and confined, and they're going to stay with us a little bit longer, then we put them into another block that is also isolated from the other inmates. And they're kept there for a minimum of 14 days. At the same time, they're being monitored by the medical staff. In the event they show any signs or symptoms, then that will be dealt with in accordance with GMH's protocols.
And what about legal visits for attorneys? Are those suspended right now as well?
For the most part, yes. However, if an attorney does need to visit or speak to an inmate, we will make arrangements. Generally, we will try to get a telephone conversation first, and hopefully that would suffice. If the attorney, needs to come in, then that attorney will be screened prior to coming in to meet with the inmate, and then that will be it will be situated in an isolated area. We'll make whatever arrangements we need. If it physically needs to be here too. Other than that, we would try to encourage telephone communicating via the telephone.
Okay, so as far as the social visits go, we had a community member reach out to us here at KUAM and address a concern, and I just want to read it, and then maybe you can respond to it here live, just to address the situation. But essentially, it's that she wanted to visit an inmate at the Manila facility, and now that she's unable to, that means not being able to give necessary cleaning supplies to her relative. So just wondering, are there any other extra steps to provide sanitary wipes, hand sanitizer, cleaning spray, or solution when it comes to the virus right now, and just taking that extra step? So I'm going to read it, and then if you could just respond to it. So I'm going to start here. It says, I'm sure most already know that our island's correctional facility is very flawed, to say the least. In critical times like during a pandemic or outbreak, our island as a whole is affected. That includes those who are incarcerated. Guam Department of Corrections is not equipped to deal with the amount of individuals that are in their buildings during a pandemic like COVID-19, nor are the officers properly trained to deal with such a large amount of people during the current situation. Every day I receive phone calls from my loved one who is currently incarcerated at the Manila Correctional Facility about how the building he is in has water outages that happen at least twice a day. Incoming drop-offs have been canceled until further notice, leaving inmates without any source of bi-weekly necessities or cleaning supplies. The inmates are not given any of the following to compensate for no drop-offs from family. This includes sanitary wipes, hand sanitizer, cleaning spray, or solution, and the list can go on and on. My relative and dozens of other inmates, 70 to 80 people in the building they are in, are expected to maintain cleanliness, and in a previously condemned building that is incredibly filthy. Let me see. Let me go. I just don't want to say the name or anything. And due to many health issues, including diabetes, just this past February, appearing to have a health concern that, and with COVID-19 on the island, the imprisonment of being in a facility they are not able to provide the necessary supplies to keep it clean and safe. And it's very concerning for my family and I. We are scared for his life. So I didn't say the exact medical concerns or, of course, any names. But just in addressing that, is DOC taking any extra steps to provide cleaning supplies or wipes and make sure that everything is in order?
Okay, so every housing unit is given cleaning supplies, bleach, pine saw, and other cleaning products. It is not given to individual inmates, it's given to the housing unit. We do have a limited supply, so it is controlled by the officer, but every unit is got cleaning supplies. They have cleaning supplies. As far as the incoming, again, the visitation and incoming was all suspended to, don't allow outsiders into the facility as much as possible to prevent any of the COVID-19 getting inside. As far as the water issues, the unit they're talking about does have some water pressure issues. We do address that. There is water. We've taken other steps to ensure that there is water in the unit. And again, that issue is an ongoing issue that we are trying to address. And to be actually honest, I think they're actually safer in prison in a controlled environment than out in the public, where they could possibly be more exposed to the disease. And in some cases, it might actually be better for the family because you don't have the families running around out there trying to buy supplies and incoming items, exposing them also to the possibility of catching this virus. So, it may actually work better for the family and the inmate that we temporarily suspend all incoming visitation.
So in the case that this does continue, does DOC have the necessary resources to continue to provide the cleaning solutions to all the inmates?
To all the housing units, yes, we do. We are constantly ordering and getting cleaning supplies. In the meantime, we ration it, of course, and we have to spread it out a little bit through all the different units. But all the units do have some cleaning supplies.
Okay. All right. Anything else you would like to add? I know that this connection is a little tough to work with right now, as I can see it's a little delayed, but in regards to security measures, just to ensure the general public that their loved ones that are in the facilities are being taken care of.
No, the director and the deputy director and the warden are working diligently to ensure the safety of the inmates, detainees, and the staff. And we'll just continue to move forward until we get through these issues. And hopefully everybody will be kept safe.
Okay. All right. So you guys, so March 16th is whenever you guys had implemented these this new protocol, and it's suspended for 30 days, correct?
As of now, ma'am, yes, 30 days.
Okay, and okay. All right, well, I appreciate you taking the time to speak with us, Antone.
Okay, no problem. I'm glad I can help.
Yeah, and be safe.
You too, ma'am, you too.
Thank you. Thank you.
Thank you. Thank you.
All right, and thank you all for listening. Again, that was Department of Corrections Administrative Service Division Chief Major Antone Aguon telling us about the different measures that are in place right now for those that are incarcerated.